Hello and welcome. I want to speak to you very briefly about a condition that is very, very important, and perhaps you may know somebody, or it may actually be something that you come across down the line. Now, it's a condition called cervical spondylosis. Now, we're just going to explain what these terms mean and then we'll press on from there. Cervical means the neck. So in medical nomenclature, what we call neck in everyday parlance, we call cervical in medicine. Spondylosis simply means osteoarthritis. Now, when we have a cartilage problem in joints outside the spine, we refer to that as osteoarthritis. But when it does occur in the spine, we refer to it as spondylosis. So cervical spondylosis simply means osteoarthritis of the neck. Now, having cleared that, what are the very common manifestations? What are the symptoms, the clinical features that could occur in a patient that has cervical spondylosis? Number one, pain. Now, a patient presents to you or you are having recurring neck pain. Now, there is another video that I've talked about the causes of neck pain. I'm going to put it up in the link, but it's very important that you are assessed to determine whether you have possibly cervical spondylosis. Now, in cervical spondylosis, the pain could be so severe. It could be just recurrent chronic pain, but sometimes could be very severe. Now, what is important about the pain that occurs in cervical spondylosis is that the pain could actually radiate from your neck, radiate to your shoulder, to your arm, to your forearm, and to the hand. Now, another definition of terms. When we say hand, in medicine, the hand just simply means this part of the body. When we say upper limb, it means from there all the way down. When we say arm, it means from the shoulder to the elbow. And when we say forearm, it means from the elbow to the wrist. Now, when the pain in cervical spondylosis occurs, you could have pain coming down from the neck all the way to the shoulder and then down to the hands. The problem is that a number of times when you present and you mention shoulder pain, if the doctor does only a shoulder x-ray, they may find nothing and it looks as if there's absolutely nothing wrong. The problem is that the pain in the shoulder is a referred pain because it's actually coming from the neck. Now, for us to get a little perspective into this, it's important to mention that the nerves that supply the upper limb arise from the neck. And so the problem that you may be having in your upper limb may actually be a problem of the neck. And so the most appropriate place to do an x-ray for would be the neck and not the shoulder or the elbow or the hand. Now, having said that, we've talked about neck pain. The other thing that will occur is that there could be some degree of neck stiffness. And this is very important because you find a situation where if the cervical spondylosis has progressed, you could have a situation where it becomes pretty difficult to turn your neck from side to side. This may significantly impair your ability to drive and carry out other tasks. Now, I need to mention that there is another condition that could present with neck pain and stiffness, and that's ankylosing spondylitis. And most likely we'll do a video separately concerning that. In addition to the neck pain and stiffness, you could also have what is referred to as paresthesias. Now, what that means is that the patient may complain, or you may experience situations where you have pins and needles in your hands, you have numbness in your hands, which a patient may describe as, it's as if blood is not getting to my hands. You may have burning sensation, you may have tingling sensation. Now, when you have these manifestations, we refer to these as paresthesias. And the reason why it's important to know this is this. The nerves, I say again, that supply the hands arise from the neck. Now, imagine for a moment that the spinal cord is like a pole, like an electric cable that gives branches out. Now, these branches from the neck supply the upper limbs. For some reason, when a patient does have cervical spondylosis, the cartilage in between is damaged or loses some of its shock absorbing properties, and then the vertebrae gives off bony spores referred to as osteophytes. Now, these osteophytes impinge on the nerve, and so the pain that you feel down the line is as a result of the impingement of the nerves as they arise from the spinal cord. So we've talked about neck pain, we've talked about neck stiffness, and then paresthesia. Now, a very important differential for this paresthesia is diabetes mellitus. If you have a patient that has a long-standing history of diabetes mellitus, they could have these features I've mentioned in their hands and sometimes in their feet. Now, why do patients develop cervical spondylosis? A very important information I need to pass across is that number one, as we get older, these degenerative changes occur. And so that sometimes we refer to them as wear and tear. Number two, if there's a genetic history, father, mother having a similar condition, you could down the line also present with same. Also, if you have a situation where you've had a previous trauma, that could accelerate the process, and down the line you could have cervical spondylosis. Now, in terms of the management, there are a number of specialties that could come to play in managing this condition, depending on number one, the severity of the condition. The rheumatologist has a role to play, the spinal surgeon could have a role to play, the physiotherapist has a role to play, and sometimes the pain management team. So it depends on the level of the severity of the condition, but these are various specialties that could, have one form of intervention or the other to carry out in patients that have cervical spondylosis. If you've learned something from this video, feel free to share and subscribe. Thanks for watching. See you in the next video. Bye.